So the interaction between the soul, the three parts of the soul with the brain will produce the psyche with the three parts of the psyche. So what Freud described, until now there's no explanation where these three parts of the psyche are. Psychology, you said that you have id, ego, and superego. But where they are, these three parts? Where you find it? Till now, there's no place in the brain that you can explain these three parts. Because actually, there's no place. Because these are the result of interaction between the three parts of the soul with the brain, and produce the animal soul, give you the id and the emotional aspect. The human soul give you the ego and the rational mind. And the guiding spirit give you the superego, related to the intuition and the moral aspect. So what we add here is the intuition that is not present in psychology, because they put the intuition as parapsychology. All the phenomena that are not explained in psychology, you have another discipline. It's called parapsychology. It's not ours. It's parapsychology, something that I shouldn't be worried to explain, because it's in parapsychology. It's not mine. So all the things that are not explained are in the parapsychology. So it's not, that means that the model that we are using is not good enough to explain the function. Just intuition, just like mediumship. There's no explanation for this. So the psychological aspect that we put the emphasis in the well-being. At the end, we want to achieve the state of mind in which the person feels able to realize aspiration in life with the sense of love, happiness, and freedom. This is the well-being. If you feel that you are doing the things that you love, you will feel happy. And if you are happy, you feel that you are free. And this is everything everybody wants to achieve. So where our conflicts and trauma came from? From our expectation, because in the id, the animal soul, have expectation. If it's fulfilled, we have the pleasure and the satisfaction. It's not fulfilled, we'll be surprised. And we have suffer, anger, and fear. So our first problem is the expectation that we have. The more expectation we have, the more delusions we have, disappointments. Okay? And the majority of our problems came from this. The second part, that the important part, the ego, the human soul come here to make, it's just like worship. If I accept everything that happens in my life as a part of this learning process, I will learn and I will progress and will feel happy and I feel freedom. It's like just to go to university and you have examination and you look to the questions and you say, no, I don't know, this question is not fit for me. Please change the questions. You can't do it. This is your examination. These are your questions. You have, if you accept the questions, you have possibility to pass the examination. If you refute it, reject it, you don't have the possibility to pass the examination, and you will find yourself again in face of the same examination again and again till the point that you will pass your examination. So the password of this is acceptation. Accept and think what it comes to help me, what it served me, this. If there is rejection, disappointment, sadness, and frustration. Okay? Sure enough, we came here to make progress. If I don't find my path, I don't know what to do, I will be frustrated as well. Because all the time I'm looking for the right thing for me and I can't find it. And by the human code, we can aid the person to help him to say who you are and what is your program and what's your roadmap. So you can understand your needs and your expectation and the origin of your suffer, and just to convert this to source of love and giving and serving the others. And this is the guarantee for you to be happy and guarantee to you to have well-being and to be in good health. Well, the superego is related actually to your creativity, and the more you are creative, the more you have a state of soul that you are going up, and related to morality. By doing things that are not moral, you start to suffer as well. What for? It's just to be free from the moral laws. So we should be ethical and not moral. The ethics says that who you are and what's your program, and you should do according to your program. And this is called ethics. Moral is the laws of the society. Not all the time these laws are fit to you. You shouldn't make war against the moral laws. You accept it, you accept the others, and do whatever you want. You understand this? Your freedom from the morality is just by accepting the others, not by refuting how the others are behaving. You accept the others and you do whatever you want. But you should do the things that are ethical for you. So the ethics is go according to your main program that you came here to do. This is ethical. So a thief of bank, that part of his mission here in this life to have this experience, is ethical to be thief of bank. It's not ethical to go to war and to kill persons in the war. He feels it's not ethical, but it's very moral. And they will give him medals because he killed a lot of enemies. So, different things. It's not the same thing, moral and ethics. So, when we have conflict or trauma, we have two ways. The first one, if I resolve the problem, both they will create stress. If they resolve the problem, this stress will be called eustress, positive stress, that push you to make and to progress and to do. Many persons that they are in stress, they have positive stress. And they feel great with the stress. Without the stress, they are not doing things. So all the time they are running with this stress. They learn, they evolve, and they feel, despite the stress, they feel very good. And this kind of stress is not risk factor for diseases. The other stress is called distress, when the conflict is not resolved, rejected. And this distress depends on the vitality of the person. If he has high vitality, will only suffer, moral suffer. But if the vitality is low, he will have the physical disease. So, in order to have physical disease, we need two things. We need trauma or conflict that create the dissonance in the system, and we need vitality is low. If you have the dissonance and your vitality high, there's no physical disease. And it will wait for you till the point that you will be weak. Maybe after 30 years, 40 years. So we understand when we arrive to a certain age, we start all the problems that we have in the past start to come up and to show up these diseases. And this stage is very important to diagnose people that they have dissonance before the energy goes low, and to help them to resolve the problem, resolve the dissonance, and to complete the learning process, and to go on another examination. So it's very important because it will be examined our success of treatment, how much we aid the person to complete the learning process. Now, how we can relate it? For example, one man has been fired from work in a way that was not expected to this. So it was very difficult to digest this problem and hit the stomach. But in one will be ulcer, and the other will be gastritis, and the third will be lymphoma of the stomach, and the fourth will be cancer of the stomach, adenocarcinoma. Where these differences came from? Why the same problem can cause different disease in the same organ? It depends. We have 4 phases of life: excitation, expansion, contraction, relaxation, that every cell rhythmically pass these 4 phases. You can imagine the heart is doing these 4 phases all the time, very clearly. The lungs, when we breathe, our stomach, our intestine, our muscles, we have all this action potential, named the action potential. And these 4 phases are related to 4 phases of stress. The first one is threat, organization, fight and flight, and resolution of the conflict. Sometimes we don't have resolution, but the trauma is very big that the system cannot face it, and that will paralyze the system. And this will be relaxation as well. Okay? So, with these 4 phases, we have 4 grades or 4 levels of fear. The first one is anxiety related to threat. The second one is the fear is related to organization. The third one is panic related to fight and flight. And the fourth one is error, when we have the stimulus is very big and the system cannot face it. And that one would be associated with reaction of paralyzation, motorial and sensorial. So it depends what kind of fear that we pass during the conflict. These 2 phases are conflict, and these 2 phases are trauma. So we distinguish between conflict and trauma by the intensity of the fear. The first 2 are conflict, and the second 2 are trauma. So, for example, if this is in the thyroid, blocked in the anxiety phase, the person will have hyperthyroidism. If it will be in the fear phase, the thyroid is related to professional, with the work. If there is conflict at work or self-expression and is associated with fear, it will be expansion and is goiter, when the thyroid will be big, expand. The third one is panic. She is panicking that they will fire her from the work, for example. So the thyroid will be contracted, and we have nodes. Contracted, we can have a hot node or a cold node of the thyroid. And the fourth phase, when we have chronic stress that consume a lot of energy from the gland, it will be hypothyroidism. Hypothyroidism. And if she lost a lot of energy, could arrive to have cancer of the thyroid. So all cancers are depletion of vital energy, extreme depletion, for trauma or conflicts that consume a lot of emotional energy and depleted the organ, and if goes under a certain level will be manifested as a cancer. As you can see here, the conflict is related to the sympathetic system and parasympathetic system, and this line as well will be changed. The more the sympathetic system is dominant, this line will be low and the excitation will become very early. So we have two kinds of changes. The first one is qualitative and the second is quantitative. The qualitative is related to the balance of sympathetic and parasympathetic system. The more the sympathetic system is dominant, that means the system is stressed. And the more time is stressed, the more energy consumed, and change the quantitative aspect is related to the height of this diagram. The more energy, the height is like this, the less energy start to be shorter. So how the psyche influences the body? We have the energy, the wave interference phenomena. If we have two waves that they are in the same phase, we have constructive wave interference, and it will give a new, bigger wave, which is the emergence of the two waves together. And this is called resonance. While if we have one wave is in the opposite phase from the other wave, we will have dissonance and destructive wave interference. So the destructive wave interference will deplete the energy, will weaken the vital energy of the body. So for each problem, and this is the interesting part now, I just give you the possibility to tell me the disease, and I tell you what the conflict that is behind the disease. If you have disease. And you can see here the meridian of the lung, you can see here. And this is the meridian of the in the colon. And when I said about the frozen shoulder, you can see that it passed from up in the back, and this is from the front. And when both are blocked, we'll have frozen shoulder because the muscle will be contracted. This is this stomach. You see the stomach here? And this is the knee. I spoke about the knee and stomach. You can see the meridian pass in the quadriceps here. That is very big muscle. When contracted, and this part is contracted, will be over weight on the knee. And the stomach blocked when we have unexpected event in our life that we cannot digest. And this is the bladder, and I spoke with the ankle here, you see, the ankle, exactly where you have your problem. You can see, and this is related to sexuality and sexual tension. We can measure these meridians. You can see here, the 24 meridians that we measure in the points, the terminal points of acupuncture. They're instrument that measure the impedance of these points. And we have information about all the meridians. You can see here, this lady is 67 years, obesity and depression, 3 times angioplasty, coronary angioplasty. She went cholecystectomy and hysterectomy, and the examination showed that the kidneys, you can see here the kidneys, both sides are depleted. And the kidneys are very important for the rest of the organs in the body. This one is a young 26 years old with multiple sclerosis. And from the meridians we can understand the conflicts that this young man had. For example, here we have the lung, the right side lung, because mother and father were separated and he lived with his mother. So we have a conflict of abandonment. We have, this is the large intestine, fear of critics, because both parents are very critical to him. We have here pericard. We have here a small intestine, not distinguishing between right and left. The small intestine is related to the hesitation and not to be sure about the things, all the time hesitating if the things that I'm doing or thinking is good or right to do or not to do. So the small intestine paid the price. Conflict of separation. I do the energy cleansing, emotional cleansing, and this is the result. Immediately. You can see how it was, this one, the blue one, and after that, immediately how it changed completely. And this young man cured totally from multiple sclerosis. I saw him for a couple of years after that for different reasons. No more problems with the multiple sclerosis, and he refused to do the CT of the brain because they recommend him to take steroids at that time, and he refused this. And after that, there's no symptoms. He was cured completely. So we can redefine health now, taking in consideration the energy and the soul and the resonance between the soul and the body. So we can say that this is a state of resonance between the physical body, mind, and soul, in which the defense system, the vitality, it's not the immune system, the defense system. It's the vitality of the body, is able to cope with the external and internal stimuli in effective way, in efficient way, that report a state of homeostasis. Homeostasis is the dynamic equilibrium that let the system function in full efficiency with very low energy consumption. This is the homeostasis. Disease is a state of dissonance between the soul and the body, caused by internal or external stimulus at an intensity that the defense system is not able to achieve the homeostasis. So we have a failure of the vitality. There's not enough vitality to cope with the dissonance, and as we saw, if we don't have vitality, the disease will appear. So we have different kinds. We have different we have different levels of intervention to diagnosis and treatment. The seventh sense, that what I show you, the human code is just to see who is the person. Body, mind, energy is the energy, the interaction between them. We can measure the blood pH, the oxidation reduction potential, and the vitality of the blood by measuring how much electrons are available for the system to cope with the free radicals in the blood. Heart rate variability measure the balance between the sympathetic and parasympathetic system and gives us how much stress the person has. Feel is fast emotional elaboration and liberation. TTRT, trans-temporal regression technique. The feel, I will show you. So we conclude that actually the unifying medicine, integrative medicine, why we need it? Because it works and we have results. And we obtain state of well-being, and this is what we want to do. Because the mainstream medicine failing to make prevention. There's no prevention. And we have all the time continuing increasing in the chronic diseases. So we have to give answer for this. And it is the reality of what our patients are doing, and we might as well offer them some guidance. That means our patients are looking for the alternative and complementary medicine, and so we should do this. They are doing already this. We don't need to convince them to do this because they are doing this. What we are doing is just to give the guidance, the right thing, what to do, and how to measure our results. Because this is the main thing, that I did another instrument that you measure the state of tension and state of vitality of the person. So everybody can see how is far or near the state of health. It's not something that depends on me. We have technology, we can confirm this, and we can use this as a scientific mean that we can make for all the population and not to wait until the person will be sick. We can prevent the sickness by intervening in the emotional and energetic aspects. The unified integrative medicine based on bio-psycho-spiritual model. So the spirituality is the main thing in this model. And the soul, we cannot do anything without soul. Body without soul is cadaver, it's not living system. Focus on the wellness as well as disease management through psychological elaboration and spiritual evolution. This is the main thing. We want to aid the person to complete the spiritual evolution, address the whole patient in their social and family context, integrate the best of all available modality, more option for effectiveness, more option for minimize toxicity of the medicine, more option to meet patient references, provide patient-centered care. And this is what we want. We want at the end that a person come back to his everyday life and feel that he is able to face all the difficulties in life and to understand why these difficulties is not against him. This difficulty is just a trigger. It's just, push you to make more things and to evolve more and more. And you change your perspective completely when you know that the things that happen to you is not against you, but for you. And is effective because actually it's very effective to resolve the psychological conflict, reduce stress, increase vitality, and complete process of learning, enhance vitality, and restore the homeostasis and well-being. And then we can conclude that love is the way. The best way to live is in love. And happiness is a sign. Happiness is not purpose. We didn't came here to be happy. But we use the happiness as a sign that we are going in the right direction. And what is direction? We want to achieve and to go back to the light. From the light we came, to the light we will come back. Thank you very much. Thank you. Thank you, Paolo. Thank you.